have back pain, I think that all Americans do. Do you want to take care of it without surgery? Well, Dr. Busch can help. We don't want to go under the knife. That's not something anybody wants to do.
You know, I don't think anybody should. A lot of people think that that's the first option when it comes to a lot of their back problems. And they think as soon as I have that surgery, I'm going to be all better. But the problem is we don't see that in people's experience. For some reason, they think that once they have it, they're going to be better. But more often than not, they actually have more problems later on. And so what I've dedicated my life to is helping people avoid needless and unnecessary back surgeries and neck surgeries. And we've been able to do that in a lot of cases.
And you do that using the DRS protocol. So tell me about it specifically.
Well, DRS stands for decompression, reduction, and stabilization. And that's really what we're doing. We're decompressing a nerve or taking pressure off of it, reducing a disc bulge, and stabilizing the whole thing so the problem doesn't return. Now, this is a group of different types of therapies, but we're using different types of treatment to actually help continue to get the best possible results. And this includes everything from treatment tables to different types of physical therapy modalities to even chiropractic, where we're actually adjusting, manipulating parts of the body or the spine, and also nutrition and even some of the mind-body things.
Well, we mentioned people, the first thing they think about is back surgery. Let's say that somebody didn't know about the DRS protocol, so they had that back or neck surgery. They still have pain. Can they come see you now?
Yes, about half the people I see have had at least one failed back or neck surgery. Okay, you know, unfortunately, the odds of doing well after a spinal fusion or something like that is about 20 to 30% over 5 years, which means almost everybody who has one of those types of procedures is going to have another one. And so those are a lot of the patients that we actually treat where they've been told that they're just going to have to live with the pain, even though they've had those types of procedures, or they may have had epidurals or cortisone injections, physical therapy. And the injections and the physical therapy in most cases aren't designed to actually do anything to help overcome the pain long term. And that's what we've been using with the DRS protocol for almost the last 24 years now.
That's a long time. You mentioned that the epidural, they don't usually help? Well, I've only had them when I had children.
Right. Well, most of the time they're actually injecting a steroid into that area. And the way that steroids work is they pull that inflammation out of the area, which helps take the pressure off the nerve, and that helps things feel better for short periods of time. Problem is, we're all moving. Movement's life. You know, you stop moving, you start dying. But at the same time, when they start moving again, it starts causing more inflammation. And in many cases, those steroids will pull a lot of the good fluid out of the cartilage, whether it's in the disc or the joint spaces, and that accelerates the degeneration. It actually causes things to get worse faster. And so what happens from a long-term standpoint is they're still looking at possibly having to have surgery later on.
So why and how did you even develop this? Because you said it's been over 20 years. So why and how did you develop the DRS protocol?
Well, the DRS, originally there was something called a spinal decompression table. It was developed by a neurosurgeon named Norman Sheely, and he actually came up with an idea that worked really well in a laboratory setting. But once we put it into an office where we're seeing a lot of patients, it didn't work quite as well. And so we developed this entire protocol during the course of the last 23 years, and where we started out working with it from one area, and then each, you know, as we continue to see more patients, we continue to add more things to it so that we continue to have the best possible results and outcome that we possibly can.
I love it because nobody wants to go under the knife, but I feel like that is a common thing. How often do you hear my back hurts?
Every single day.
I know you do, but I do too, and I'm not in your business. So is it just as simple as giving you guys a call?
Yes. 260-471-4090, or you can certainly fill out something on the form on the internet at buschchiropractic.com.
All right. If you are dealing with back pain and you don't want that surgery, all you have to do is give Busch Chiropractic a call today. We'll be right back.